a nurse who secretly filmed for the BBC's Panorama to...
11 days ago, Margie faced the tribunal panel for the final time. 4 years after she'd filmed undercover, the Nursing and Midwifery Council delivered its verdict. It struck her off the nursing register.
I'm absolutely devastated.
The panel said she deliberately and repeatedly breached patient confidentiality in filming elderly and vulnerable patients, many of them in the last stages of their life, who should have been able to trust her. The panel said that was fundamentally incompatible with her duties as a nurse.
By striking her off the nursing register, the tribunal imposed the toughest sanction available.
Nursing's been a big part of my life for over 20 years and I don't know anything else I can do. So I knew it was a risk, but I thought what I found on the wards and what I did film, I thought far outweighed the risk, and it was the public needed to know what was going on.
The outcry against the verdict began almost immediately. The Royal College of Nursing has set up a petition in Margaret's favour, and in your emails to our programme, many of you have spoken of this outrageous action, with a registered nurse telling us she feels this decision was a complete travesty. And a man asks that Panorama doesn't drop this story for the sake of our mums and dads and us in a few years' time. The friends and relatives of the patients Margie cared for want to ensure their voices continue to be heard.
I was absolutely disgusted with the verdict. It shouldn't have been Margie that was on trial. It should have been the people who run that hospital and the supervisors. They were the ones that were wrong. They were the ones that caused a lot of the problems because they weren't doing their job properly.
I couldn't believe it. Actually, I was shocked. There's somebody who did us all a favour, who did the nation a favour, and to be punished like that. No, that's it really is unacceptable.
There really has been an impassioned plea that something should be done to address this situation, particularly as the recurring theme is that people recognise that Margaret Haywood's ultimate motive was safe patient care. We think it's harsh, we think it's disproportionate, and it was not at the level of sanction that we expected.
The health service has lost a nurse of 20 years' experience. Striking her off the register is a life sentence for her professional reputation and future. And now Margie has lost her job, providing nursing training to carers and nurses.
I have a mortgage, I have a house, I have a car to pay for, and probably no income, so my life's just finished totally.
Margie and her legal team are planning to appeal against the ruling. But how to care for the elderly is a challenge for us all.
In 30 years' time, when you're potentially the patient, what kind of care do you want?
Do you know, I wrote a letter while I was living and working in Brighton at the Trust, and I wrote it to my children saying, if I was ever in this circumstances, please make sure that I'm being cared for correctly, and I've still got that letter.
It's in your purse?
Yeah, it's been in my purse since I wrote it. And it's dated the 24th of the 1st, 2005. And it says, to my dear family, just in case I ever have to go into hospital and I can't speak up for myself, these are the things I want you to do on my behalf. First of all, make sure the ward is clean and comfortable and warm. The ward has a good manager and I have a named nurse for you to liaise with. I have an up-to-date care plan. I'm getting appropriate and effective medication and I'm not left in pain. That I'm kept clean and not left in my own poo and urine. And that I'm being reviewed regularly by medical staff. That I'm being fed and hydrated and my charts are being filled in. And ask if there's any infections on the ward, but most of all that they allow me to have dignity, self-respect and hold my hand when I'm lonely. Is this too much to ask? I love you all, Mum and Nan. Signed, Margaret Haywood, RGN.
Margie Haywood reading the letter to her family that she carried in her purse while she was working in Brighton. And if you want to join the debate about the standard of healthcare, or find out more about what you can do about it, or discover what's been happening to Margie since we filmed, you can go online now.